Good morning, dear students. In today's session, we will discuss about the theme and the title of the story and about the character of Andrew Manson. And then we will discuss the questions of the chapter. Right. So let us first talk about the theme of the story. That the story birth, it centers around the character of Dr. Andrew, who miraculously revives a newborn child given up for dead. Dr. Andrew, he was a young doctor who was struggling to establish himself as a medical practitioner. Moreover, his evening had been quite disappointing with Christine, and he feared that the night would be no better. But he ends up doing something real by reviving a child which was still born. Thus, we see that how the story it also brings out the theme of never say die attitude and the precious gift of life which only God can grant and a doctor can retrieve and restore. And that is what fulfills a doctor. So that story, it brings home the main idea that how a noble and selfless action has its own reward. It never goes unrewarded. It gives the doer a rare sense of joy and satisfaction. So when we see Dr. Andrew, he feels disturbed and distracted, but decides to concentrate on the task assigned to him. We see him doing his job with full devotion and concentration, and he is able to save both the mother and the child. He applies to the case all that he has learned as a part of his medical training. So when he succeeds, he feels he has done something real for the first time in his life, and he has a rare sense of fulfillment. So this is the theme of the chapter here. And if we talk about the title of the story, we see that how A.J. Cronin could not have named the story more appropriately as it revolves around the single event of birth of a baby. So when we see that for the Morgans, the birth is a much awaited and very important event as the baby was conceived after 20 years of their marriage. So the baby, it was precious, and Mrs. Morgan would not like to be administered by the chloroform, and if it was to harm the baby. And when the baby is actually born, it we can say its birth leaves the doctor, the nurse, Mrs. Morgan's mother in a shocked state of mind because it was born lifeless. The nurse even gives it up for dead, and she keeps the stillborn child under the bed over some sodden newspaper. Dr. Andrew as well, we see that he was very much disappointed because the stillbirth would mean he was a failure as a doctor. He also had promised the couple, so he was also thinking about the promise that he had made because he was then failing to fulfill the promise. He could not keep the promise he had given to Mrs. Morgan. And at the climax of the story, we see how he feverishly works on reviving the baby after saving the mother's life. His desperate efforts result in the miraculous survival of the baby. Thus, the birth of the baby and its ultimate survival means that the doctor has proved his mettle beyond any doubt. He has done something real at last. The Morgans are happy parents of a baby. The grandmother and the nurse, they are also happy, and thus we see the grandmother saying prayers of thankfulness to God for the gift that He has granted them. So we see that how at the end everything goes all right, and we see the doctor saying, "Oh God, I have done something real at last." And he rightly thinks that the night of of this the birther is going to actually influence his whole future in Villanelli. So everything is connected to the birth of the child, and thus we see that the title birth is appropriately chosen for the story. Yes, dear students, so now we will discuss the question which is given at the back of the chapter. The first question is I have done something. Oh God, I have done something real at last. Why does Andrew say this? What does it mean? Now, Andrew, we see that he has uttered these words when he comes out of Joe Morgan's house. He is fully satisfied with the work done, and he said these words, I have done something. Oh God, I have done something real at last. So, in the beginning of the story, we see that Andrew, he was returning back home after having a disappointing meeting with Christine. He was in a very disturbed state of mind, but still he listens to the call of the duty when he saw Joe Morgan waiting outside his house. He immediately accompanies him and comes to his house to attend Mrs. Morgan. And when the procedure starts and the child is born, we see that the child was a stillborn. Andrew was horrified. He had promised the couple that everything would be all right, and now he was in a state of dilemma because on the other side, the mother, Mrs. Morgan, was also in a very desperate state. She was also collapsing gradually. So, instinctively, without thinking, he gave the child, the dead child, to the nurse and he started treating Mrs. Morgan. When Mrs. Morgan was quite all right after he gave her the injection, he turned towards the baby. He saw the baby, which was lifeless. The skin of the baby was white in color, and he came to know that it was because of the lack of oxygen. The baby has not breathed, and thus it was stillborn. Immediately, he asked the nurse to bring two basins of water, in one containing hot water and the other one with the cold water. And when the nurse brought, first of all, he tried to give the respiration method, it failed. And then he started dipping the baby into the hot and cold water alternatively. And again, the efforts became hopeless because there was no result. And then he started rubbing the chest of the child and pressing the chest of the child vigorously. And at last, he was rewarded. He noticed a heave. He felt a convulsive heave under his palm, and he saw that after when he redoubled his efforts, the child it began to gasp for breath and it gave a cry as the mucus came out of its nostril. The child was alive now, and Andrew, the nurse, and the mother, they all were happy at that moment. So, after coming out of Joe's house, Andrew experienced a rare sense of fulfillment. He felt satisfied for the work that he had done. He feels that he has done a real act, an act of saving a mother and her newly born child. He thanks God so far as he has done anything worthwhile. So, in his eyes, giving life to someone is the only real act in the world, and everything else seems to be false and worthless. Thus, we feel that Andrew, he experienced that kind of emotion which was very rare. He felt extremely, we can say, satisfaction at that time, and he was overwhelmed with that emotion. And in that state, he thanked God, saying that I have done something real at last. Oh God, I have done something real at last. I hope this answer is clear to you all. Now, let us move on to the next question, that is, there lies a great difference between textbook medicine and the world of a practicing physician. Now, textbook medicine is based on research, experimentation, observation, and systematic documentation. So, it is authentic and it gives a physician a lot of confidence. The physicians, they practice on the basis of these documentation. And it is something universally understood and followed because every practicing physicians follows those kind of medicines. So, yet when it comes to treating the patients, the practicing doctors, many times they find a difference between the text and the ground reality. हकीकत जो होती है और जो टेक्स्ट बुक में बातें लिखी होती हैं कई बार बहुत फर्क होता है. Sometimes they go out of the way for the treatment of their patients. So, innumerable factors like the patient's faith in the doctor, the patient's willpower, mental makeup, financial situation, the social and the cultural background make all the difference. Thus, we see that uh, In spite of the efficacy of the medicine and the competence of the doctor, different people respond to treatment in a very different manner. And besides, many a time it is also seen that a prayer works miracle when the textbook offers no cure. So we see that, yes, of course, there is a great difference between the textbook medicine and the world of practicing physician. So sometimes the doctors, they go beyond the remedies provided in the books. The way we see Andrew Manson applying the technique which was once utilized in the Samaritan, in the place known Samaritan. So he had gone beyond the textbook knowledge and he tried the method of respiration, and he started dipping the child in the hot water and then in the cold water. And thus we see that how, because of his efforts, the child was actually resuscitated. So, thus, it is quite true that practicing doctors often use methods which find no mention in the textbook. And thus, we can say that life itself is a great teacher and a big laboratory as well. Right, students? So, this is about the questions of the chapter. Now, in the next session, we will discuss the questions of the practice papers. Right? Thank you all. Keep learning.